Pei-Wei。100跟那个康定的话，应该也有，应该也都上线了。有。
印尼是下个礼拜吗？还是下礼拜？
考察吗？
对，
这个礼拜天。
Okay, next week our team will go to Indonesia for the visiting, and also the team from the industry will also come together. We hope we all have a very good collaboration.
Doctor, when is the time you will come to Indonesia? Can I know the date and the month? I'm sorry.
Hello, Dr. Tedy. We will visit Indonesia on December the 11th to December the 17th. So we will visit some of our institutions that we signed an MOU together, and then also to visit some of the industry companies in Indonesia.
Oh, baik, makasih.
So maybe you can post the date on the chat box. 就是你在那个通话讯息上打上日期。
Okay.
Please post the date of the visiting on the chat box.
Sure. We will share that soon. Okay. So I think all of our moderators and speakers are all online right now, and we also start our live stream on YouTube just 1 minute ago. So I think probably we can start this online conference by now. So firstly, thank you everyone from Taiwan and from Indonesia, from the hospital and the industry to join this digital health tech webinar this afternoon. My name is Grace Wan from Far Eastern Memorial Hospital. So today we will have several guest speakers from our hospital and also from UKRIDA and from Airlangga University Hospital, and also the industry representative from Taiwan to share their perspective of how the companies and the hospitals develop the digital innovations in the healthcare industries. So firstly, I would like to invite our Vice President, Dr. Chih-Hung, to have our opening and also to have a short introduction of this online conference. Thank you.
So why not have a group photo together?
Sure.
Should we have a group photo together?
Yeah, sure.
Everyone,
so let me just stop.
Turn on the camera.
So let me just stop sharing this, and probably we can see each other clearly. Okay. So can everyone turn on the video? All right. Can see each other, which is nice. All right, so probably I just count down from 3, 2, 1, and then we can have a really nice smile, and then we have a screenshot together. Okay. All right. So 3, 2, 1. Thumbs up. 3, 2, 1. 3, 2, 1. All right. Thank you. Thank you, everyone. Thank you, everyone.
Now we will start our webinar meeting. Okay. First, I will introduce with Mandarin first, because we have some online audience. 各位亚东医院的好朋友以及线上的听众，大家好。那欢迎来到参加我们亚东医院跟印度尼西亚双边举行的新南向智慧生技产业论坛。这是我们亚东医院为了促进台湾与印尼双方对智慧生技产业发展的互相了解，那我们特别举办了这样一个论坛。我们邀请了在台湾有 AI 人工智慧的专精的医师，包括熊佩伟主任还有郭冠宏主任，来跟大家分享成果。那印尼的医师呢，会分享印尼在智慧医疗的进展与领域的需求。然后我们也邀请了4位台湾的新北生技产业联盟的生技业者来这边介绍这个产品的研发与应用的场域。我刚刚讲话的时候那个声音好像有点回音，是不是？没有吗？大家都听得清楚吗 ？OK， 好， Dear distinguished guests and our friends and colleagues, good afternoon. Far Eastern Memorial Hospital is one of the medical centers in New Taipei City, Taiwan. And since May 2002, we were selected by our government, the Ministry of Health and Welfare, to strengthening the medical collaboration between Indonesia and Taiwan. So today we are very honorable and very pleased to invite the experts from Indonesia and from Taiwan to join this online meeting. We will welcome Dr. Sheung Pei-Wei, Kuei-Hong from Far Eastern Memorial Hospital, and Dr. Wani from UKRIDA University, Dr. Tedy from Airlangga University Hospital, and Dr. Tuan Juniar from UKRIDA Hospital. In addition, we will also invite the representative from New Taipei City Biotechnology Alliance, to including these companies, including COMDEK Industry, EPED Inc, SEDA Chemical Products, and Wellell Inc, to join us. Through this opportunity, we hope we can build a good connection between each other and help understanding the medical technology and the healthcare service from each country. So please join our meeting. Now I will forward the chair to Dr. Chih-Hung. He is the chief of AI department in our hospital. So Dr. Wang, please, now your turn. Please turn on your microphone. Dr. Wang, please turn on your microphone.
Okay, thank you everyone for joining this online congress between Taiwan and Indonesia. And first, I would like to introduce our first speaker, Professor Sheung Pei-Wei. He is the Director of Radiation and Radiation Oncology, and he is also a professor at National Yangmin Jiao Tong University. He has a lot of great work and the collaboration with a very big AI company and industry of technology. So we will introduce Professor Sheung, and he will speak with us the application of AI technology in radiation oncology fields. Please welcome Professor Sheung.
Okay, thank you, Dr. Wang, for your introduction. And I will share my slide and to all of you. Okay, I put in the full screen. Okay, everybody, and I will talk about the role of AI in radiation oncology, focusing on our auto contouring system during head radiotherapy treatment. I'm Dr. Sheung, the Chief of Division of Radiation Oncology and also the Department Head of the Radiology. I will talk about why we designed the AI auto contouring system from the background and the purpose and the method, and then talk about our result, and finally make some conclusion and discussion. Everybody know that for cancer therapy, there's a 5 pillar. 20 years, 30 years ago, there's only 3 pillars: radiotherapy, surgery, and chemotherapy. However, from precision therapy such as immunotherapy, target therapy, and even cell therapy, there is a lot of advance in cancer therapy. So there are some cancer treatment achieve a great result, such as even the very best stage 4 lung cancer. There's we can prolong terminal stage of the lung cancer survival rate and even improve quality of life. However, talking about the radiotherapy is a very important local regional control for primary tumor, or even they can control the metastatic lesion and improve the neurological symptom or a lot of cancer complication. I will talk about our department because we have 2 tomotherapy machines and 1 linear. Every day we treat about 100 patients per day. We have some special clinical achievement in my department. In 2008, we developed the first Asia experience of the total marrow irradiation before bone marrow transplant. It's for the hematology tumor. So before bone marrow transplant, we hit the target. The target is a total marrow, not internal organ. And then 2012, we developed first global experience of helical tomotherapy of total skin, so-called the HITS. It's for very severe skin lymphoma, spread whole body of the skin. So it's a very complicated technique. Such as you can see the red line, red color. This is represented the high radiation, focusing on the whole body skin. And then last year we just complete the first global experience of using the so-called low dose radio ablation to treat intractable ventricular tachycardia, because you know that is a very complicated technique. We just in United States they developed 25 grade. However, we have clinical trial. We found that the 12th grade can successfully control the tumor with intractable ventricular tachycardia, and we published the result this year. And this slide, you can see that this is innovation of radiation oncology. 50 years ago, we only have 2D radiotherapy techniques such as COMDEK and the conventional old so-called old linear accelerator. However, from 1990, we have the technique more improvement, moving to the 3D conformal radiotherapy, stereotactic radiotherapy, and the intensity modulated radiotherapy or image guide radiotherapy. Now it's a routine in Taiwan using the image guide radiotherapy, such as volumetric arc radiotherapy, tomotherapy, cyberknife, and the MR image guide linear accelerator. Or even in our hospital, there is some hospital already installed particle beam radiotherapy or carbon ion therapy in Taiwan. However, no matter what kind of the complicated technique, you can see that from 3D image, we need CT image to contour the tumor and to have treatment plan. This is our major process of the radiotherapy, such as from consult, CT simulation, we get the image, and then we have we should draw the tumor, lymph node, and the risk area, and we have treatment planning, and then patient under treatment, and then we have follow-up. However, the most one of the time-consuming procedure is treatment plan, because the treatment plan, especially for the head and neck cancer, not only dose planning, but also is a time-consuming procedure is for contouring. We should contouring the organ at risk and the gross tumor and the lymph node drainage area. You can see that is our current problem. We almost take about 2.5 hours to manually to draw the contour on the computer, such as organ at risk. We have a lot of more than 100 CT scan, and there's a lot of critical organ you should draw. So it's a repetitive works, and usually there is an individual discrepancy and even error. And also we need another 2.5 hours to draw the primary tumor and the lymph node, neck node area. So before radiotherapy, we should design this plan. And however, during treatment, some patients will loss of body weight and shrink of the tumor or even edema of the patient. So you should change the plan. You should draw another adaptive treatment plan. You should draw the organ at risk and the nodal area. So it's a time-consuming procedure. So our end of the project is to time saving. We should save our time during the contouring of the before radiotherapy plan. We need to time-saving procedure, and also we need to develop an international criteria. There is a consensus say that it's a safe AI contouring system, and also it's adequate labeling that we can save the contouring, because currently there is some commercialized radiotherapy plan. There is auto contouring of the organ at risk. However, there is hardly have the system to automatically draw the lymphatic drainage area. So this is our method. You can see Far Eastern Memorial Hospital, we cooperate with the Quanta Computer Company. After 3 years cooperation and development, you can see that we started the project from 2019, and then clinical application of the AI contouring system in our department is last year. I will go into some procedure. Firstly, we should collect the data of the ground truth. We screen our more than 500 head and neck cancer patients in our department prior treatment, and also we select 2,023 patients with diagnosis of nasopharyngeal cancer, oropharyngeal cancer, hypopharyngeal cancer, and the laryngeal cancer. And then we labeling 14 organ areas. That is so-called the normal organ or critical organ, and 6 lymphatic drainage area. So totally, we have select more than 3,000 organ areas and 1,300 neck node area for the AI training. This is so-called the ground truth. We withdraw the contour for on the CT scan image and then send to the AI system for AI system training. So this is a very complicated CT image. You can see that we should standardize our labeling procedure. You can see that there's 14 organ at risk. There is a oral cavity, tongue, and also a lot of spinal cord, bone, and the parotid gland. A lot of organ you should draw, even bilateral, is a 14 organ. And the 6 neck node from the level 1, 2, 3, 4, 5 neck node level. Because we based on the international consensus published in 2015. So it's a very standardized labeling material. And also we use the supervised by deep learning system. Hardware is designed by the Quanta Computer, and they use the UNet deep learning model. And the deep learning model can detect the new our organ size and location, and then after auto segmentation of the neural network, you can see that we target auto segmentation of the 20 organ areas and the 11 lymphatic drainage area. And also you can see not only after the initial AI modeling, we should optimization of AI model. Then next year we selected another 100 head and neck cancer patient, and the revise and optimization AI generated organ areas, 20 organ, and the AI generated nodal area 11 site. And so totally we have optimized using the new data about 2,000 organ areas and 1,000 lymphatic drainage area. You can see that this is our workflow, and when patient complete the CT simulation, there is a lot of CT image, then sent to the AI system, and on AI system make analysis and auto contour, and then they generate the organ areas and the auto contour of the lymph node area. Then as a physician, I will check the contour, and I will then, it's okay, I will have a treatment planning. I will approve the plan, then patient can under radiotherapy treatment. And you can see that after complete the auto contouring and then transferring the data to the treatment planning system, we implement our AI system to our department last year in July. It's a very fast and accurate. It's a very good system. And our result, I will show you our result. You can see that auto contour of 20 organs at risk and the 11 nodal area. And also we can reduce the individual discrepancy in manual contour, because a different physician and even our medical physicists, because there is a personal training. Maybe there is some individual discrepancy. So there's a lot of paper describe this. There is some individual error between everybody and every center. So we use every die score to evaluate our AI system. You can see that the average die score for the 20 organ risk is 0.94. And the average die score for the nodal area is 0.81. So average more than 0.08 is a very good. That means that there is a very accuracy for the AI system. So it's a die score is very good. And you can see another benefit is a time saving. It's a very fast auto contouring function because it fulfills international criteria, and also it's a painless and a smooth connection to our original treatment plan, and also save about 50% of the time for the contouring our system. Also, we present the result in our society meeting last year, in recent 2 years, and also we can save a lot of time to take our patient, and also a lot of cancer research. Now I will make final discussion and conclusion. You can currently we have a patent application for our AI system, Taiwan, China, and the U.S. patent. We want to become the first Taiwan AI auto contouring system in radiotherapy of head and neck cancer. And also, futurely, we will still continue to improve and test our system in other hospitals in Taiwan, such as Tri-Service General Hospital, Taipei Municipal Wanfang Hospital. And then we want to expand the labeling system because it's in head and neck cancer. We have confidence. We cooperate with the contact computer company very well, and so we will expand our system to develop furtherly for the thorax, abdominal, and the pelvic malignancy. I think in the future we can save a lot of time using this system in whole body. Thank you, everybody.
Thank you, Professor Sheung. Thank you for your excellent talk. And now we will move on to our next speaker. I would like to introduce Dr. Kuei-Hong. He's a radiologist and also neurologist as well. And he's a specialist in radiation, radiology, and neurology. And he's also a very famous AI specialist of Taiwan. And another very important fact of Dr. Kuei is that he is also the winner of the 2022 National Innovation Award. So now I will welcome Dr. Kuei, and he will talk about us. He will speak for us the application of AI technology at Far Eastern Memorial Hospital. Welcome, Dr. Kuei.
Hello, everyone. I'm Dr. Kuei-Hong from Radiology Department of Far Eastern Memorial Hospital. I'm going to introduce what our team have done in the field of medical AI. I have done medical imaging AI for 5 years, and I realized the bottleneck of AI is not training the model, but preparing the data. Therefore, our team built 3 systems to clean, search, and annotate the image data. First, we made an automatic system process to clean, re-index medical images, change image format, and archive them, and made a new research image database. All of these steps can make search data and compute data efficiently. Second, we made a fuzzy text search tool. It is a very easy use, but very powerful. Last, we also built a cloud annotate system to manage project data and the labels. This is the text search tool we made. It can search any kind of text pattern. It can search positive and negative sentence at the same time and directly visualize the result like this. Without coding needed, researcher can get 30% more searching cases and a higher accurate rate than traditional keyword search tool. When we retrieve the data, when we retrieve the case list we want and already built the research image database mentioned previously, we can just select, filtered, and immediately get the case we want, which is already ready for AI training. This tool can save us 3 months with data preparing time. The cloud annotate system, including data tool and image annotator. The data tool can make data sampling, data group splitting, and the patient information protection easily. The image annotator has many functions and integrates with the IMS system of our hospital. So the label doctor can check lab data, reports, or even see other views or other images as reference when they do the labeling. Besides, the image display time is super short, which can help doctors to check label efficiently. In recent 5 years, we cooperate with company, university, and other hospitals. We clean more than 1 million images and label more than 250 images. We made 3 AI medical solution products, participate healthcare and health tech expo every year. We won 3 national awards and published some research papers. Most importantly, we made 3 AI systems with 50 AI models working online clinically. Then I'm going to introduce the clinical use AI in our hospital. First, I want to introduce the chest X-ray AI system. We cooperate with Quanta Computer Company for 5 years to make this system, and now it is a product for sale. There are 2 major functions. First, active alarm. The system can automatically detect 4 major or emergent diseases in chest X-ray, which are pneumothorax, pneumoperitoneum, fresh lung tumor, and the endotracheal tube malposition. AI can actively send alarm to doctor in charge within 15 minutes after examination. The doctor can see images at home, at hospital with computer or cellular phone, like this. Second function, AI-assisted auto-reporting. It means every chest X-ray, the AI will give report first. The doctor revise it later. If the AI report is correct, doctor just 1 click and the report will be submitted. We have used these systems for 2 years and proved that the system can double the productivity of doctor, like this. Okay, this is the chest X-ray AI system we designed. The system can display present, and the previous images simultaneously on 2 monitors. These are 2 monitors. On the left monitor, the right top is the image viewer here. In the beginning, there would be no mark on it, which would not interfere doctor's first impression. On the left bottom here is the auto-reporting window. Once the auto-reporting window here, once the image is loaded, immediately the AI report is shown. The speed just like this, image report, image report, image report, pop, 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 just so fast. Okay, then the left top is the disease button. If AI detect a disease, there would be a warning sign on the button here. Not like our competitor, we don't show all the detection on one screen. Instead, this is what we do. When the mouse cursor moves over the button, it would be a box shown on the image viewer to hint the doctor where the corresponding lesion is, like this. When the mouse cursor leaves the button, the box disappears. This is what we designed. One stop, end-to-end, friendly and increased productivity. This is our product. The second AI system we made is Brain City AI. There are around 10 models working in the system, and most of the models, as well as the reporting system, the blue one, and the job of deploying the models were all done by our team. We focus on the brain hemorrhage and the trauma, which are the most frequent 2 diseases in brain CT. The AI can differentiate 5 types of hemorrhage, calculate the amount of hematoma. The AI can also detect the brain ankle herniation and the skull bone fracture. We have deployed the system clinically for 1 year. both the radiologist and the clinician can see the structured AI report in around 10 minutes after examination. The report will be shown on the radiology reporting system, this one, like this. And click the link, the image viewer will show the AI detect mask, like this, the red one. The report will also be shown on the IMS system for clinician, like this, like the black one. There is a button here. Button here before the formal report made by the radiologist. Click the button will show the AI report. After the formal report is done, click the same button will show the formal report. For clinician, no habit is changed. The brain CT AI saves a lot of time in diagnosing severe brain conditions, especially in the meantime, and increase the speed of further treatment. Finally, I also want to introduce the AI model we just deployed online last week. This AI can help detecting pneumoperitoneum in CT, which means bowel lobe perforation and is a life-threatening disease. We just finished a clinical test with 14,000 CTs with good sensitivity and specificity. We then deployed the model online since last week. The result is quite hard. There are 8 alarms in the week, and 6 of them are correct. We will focus on solving acute abdomen condition, such as acute appendicitis, cholecystitis, stone peritonitis, bowel lobe obstruction in the next year. In summary, today I have presented 3 data systems to help medical professionals to prepare data for AI training. Besides, I have briefly introduced 3 online AI systems now working in our hospital. I'm Dr. Guo. If you are interested in what we do, please contact me anytime. This is my contact information. Thank you very much for your attention. Terima kasih. Thank you.
Thank you, Dr. Guo, for your excellent speech. And now we will move on to our next speaker. I would like to introduce Dr. Wani Devita Gunardi. She is the rector of UKRIDA University and also a professor in microbiology. Today, we are very honored to invite Dr. Wani, and she's going to talk about the development of health tech in Indonesia. Please, Dr. Wani.
Thank you, Dr. Chang, for inviting me to this webinar. Yes, I'm very glad and be honored to have a chance to sharing the development of health tech in Indonesia. May I sharing my PowerPoint or my presentation?
Yes, please.
Okay, but okay, thank you. Sorry. Okay. Sorry, I have difficult to share my presentation.
Ada yang bisa dibantu, Bu?
Ya, ini saya share-nya di entire screen ya?
Iya, di entire screen.
Oke, terus?
Langsung diklik OK aja, Bu.
Siap.
Ya.
Tapi slide saya belum keluar ya?
Untuk saat ini belum.
I cannot share. Okay then. Sorry for my PPT or my presentation cannot be shared. I try once more. Cannot share, Mr. Gilang. Okay, sorry for this inconvenience for sharing my presentation. So I'm sorry, and I will tell my presentation as the future of AI in medicine. The outline is I will give the introduction, AI application in medicine, and benefit of AI in medicine. Yeah, as introduction, as we know, machine learning models are used in medicine to scan medical data and unearth insight to assist enhancing patient experience and health outcomes. And then, yes,
Maaf,
yeah.
apa ditukar dulu ke Dokter Tedy ya?
Oke.
Nanti apa slide-nya nanti kirim ke saya aja, Bu.
Oke. Yes. Thank you. Yeah. I give back to Mr. Wong. Sorry, Mr. Wong.
Okay, so will Dr. Tedy speak first? Yes.
Dr. Tedy, could you have to present the presentation? We will. Yes. Thank you.
Yes,
Dr. Tedy, welcome, and he's a neurosurgeon and assistant professor at Airlangga University Hospital. So we will invite Dr. Tedy to speak first, and then we will go back to Professor Wani later. Okay.
I think I give my presentation to Gilang.
Yes.
I give my presentation to Dr. Gilang Putra. Okay, this is my presentation. Thank you so much.
Okay.
So nice to meet you all. My name is Dr. Tedy. I'm a neurosurgeon in division of oncology. I'm now working at Airlangga University Hospital. My position now in Airlangga University Hospital is manager of innovation and development plan for our hospital. Maybe our AI is not good enough in our developing, but our hospital is still young. We are established in 2011, and our service is just begin at 2014. So this is our 8 years in process for our health service. Next slide, please. So maybe in our hospital or my hospital, our AI is still in the health service for our patient. So it's still new, our AI in our hospital, because we still cannot use for data of medical, maybe radiological data, or maybe medical data is not ready, because still our position as a manager of development in our Airlangga community is we try to make the best AI for our hospital. So this is our patient registration, and this is still new in our hospital. Usually we are use a paper, a medical record with paper. Now we try to move forward in the paperless in our hospital. Next slide. Yes, next slide, please. Okay. One of our problem is because we are a young hospital in our city, so we try to bring access in social media. How we try to bring patient in our city. We are in the East Java, Surabaya. We try to make access to our people in East Java by using a website, Instagram, and every unit about our hospital will be given into a patient help desk. So this is our AI for give health service and customer service with AI system. Next slide. Yes, for medical, our medical record is still, we are still in ongoing process. So this is not, we still cannot run this application with smoothly because this is in our development program, and I think there is no time for our late, but now our IT system still in developing, and it is very difficult for us to give digitalization like this to our doctor and our nurse, because we must move from paper medical record to digital medical record. Next slide. This is our medical record for rehabilitation medic, and all of anamnesis and all the physical examination or diagnosis. We still try to make a big data about our patient, and our problem is the patient identity and date of visit, examination name, anamnesis, and all of it. Still, we cannot 100% have the information about our patient, but we try to connect all the unit in our hospital, so our big data about the medical data in our hospital will be complete maybe in these 5 years. Next slide. Yes, next slide. Okay, thank you. The new one in our hospital is for our formation drug prescriber. We try to bring we call it a recipe to help patient for drug delivery system, and for all the validation will be final from the doctor, but we still have to introduce this system to all of our doctor. We have about approximately 200 doctor in our hospital, and not all the doctor in our hospital know this program, but we still try to bring them some knowledge and education in each of our doctor. So maybe in the next future, all of our doctor will be use this recipe in our hospital. Next slide. Yes, for we have 1,095 employee in our hospital. All the nurse, the doctor, or maybe the secretary, and maybe the radiographer, or maybe the others. We have 1,095 employee, so we must make a data about them. And in here we can see there is a the employee that come when they are come to our hospital, and there is a employee that out. So we must have this employee data to present real-time staffing data in our hospital. And in the future, I think this will be make a magnificent advantage for our direction. Next slide. This is the one of the employee data, because we can help to retrieving the data as we need it. Maybe we can warning for employees for their certificate, and we maybe have a hospital operational permit and the others. Next slide. This is our A laboratory. We call it SIP. In Indonesia, we call it as SIP Perdana. So this is our AI for laboratory result. In the future, we hope that the patient can see in their handphone, or maybe in their smartphone, what the result of the laboratory. So the patient do not have to come to our hospital, and they can see their laboratory result in their home. Next slide. This is our smart lab. So this is for recording and reporting our laboratory tests. The advantage is so the patient can input the laboratory result by themselves. Maybe they can see the list we can see the list of the patients who will laboratory check today and the day before. So it is like a reminder for us. Maybe the third one sample system using blood and serum tube and to see the patient laboratory test. All of this data will be our compiled in our recording of, we call it smart lab system. Next slide. Yes, this is our meeting room management. So because my position now as the manager in the Airlangga University Hospital, so we have a lot of schedule for our meeting. So to make this is more easier for our management in our hospital, so we make this reminder for them. Sometimes they can see in their smartphone when we have to make a discussion or maybe a meeting board or the other. We make this help desk to monitoring our meeting room management. Next slide. We call it this system as Cerdi in Indonesia. Cerdi is, I think in English is the smart one. Cerdi, the smart one. This is information about our monitoring and evaluation in our teaching for our student. So all of this in the chart in my presentation, it is about our student, maybe our resident, maybe our medical student. All of them, when they came to our hospital, we must know their progress to have their knowledge in our hospital by use this system. We call it the smart one or Cerdi in Indonesia. This is our monitoring and evaluation for the teaching for my student. Next slide. Yes, this is our billing patient. I think we don't have. I don't have to present this. Next slide. Yes, next slide. Yes, this is our new one. We try to make an automatic health examination. This is a collaboration with our hospital and telecommunication university. This is we have one, but still just in prototype. So we hope that our prototype will be better next time, because in this automatic self-health we can make sensor technology, can check weight, height, blood pressure, heart rate, blood frequency, body temperature, and oxygen saturation. So the patient maybe can come by themselves and go by using this health examination by themselves. Next slide. Thank you so much. I think that's all that I can give our progress about our digitalization in hospital. We still cannot make a compile about patient data in disease or the other, but we try for our development. Thank you so much.
Thank you, Dr. Tedy, and congratulations on your health information system. It looks very informative and graphic. And Dr. Wani, has your slide been okay now?
Yeah, I've already give to Mr. Gilang.
Okay, so can we share Dr. Wani's presentation?
Okay.
Okay, please give your talk, Dr. Wani. Thank you so much.
Yeah, thank you, Dr. Wang. I'm sorry for the inconvenience matter. Yeah, I would like to say that UKRIDA or KRIDA Wacana Christian University, as one of the university that has a faculty of medicine and UKRIDA hospital. We are in the center of Jakarta. Now we would like to talk about how the EI in the medicine. This is, I think, we realize that we are not using EI a lot in all our healthcare facilities, especially in Indonesia. As we know, we are just use e-medical record in few years ago. Let's say 10 to 15 years ago. Like Dr. Tedy said, using e-medical record has many benefits to get the data compiled. This is our hope, what I like to say in my presentation, that AI application in medicine and benefit of AI in medicine. Next slide, please. As we know, medicine learning models are used in medicine to scan medical data and to assist enhance patient experiences and health outcomes. Artificial intelligence has recently made significant many benefit in computer science and informatics. And it's now becoming a crucial component also in contemporary healthcare. And clinical decision assistant and image analysis are currently using AI also. As Dr. Sheung and Dr. Kuei said, in radiology has many benefits using AI technologies. AI technologies are being used to analyze CT scan, X-ray, MRIs, and other pictures in the field of medical imaging in order to look for lesion or other findings. Some of our healthcare facilities in Indonesia have already used this service to help the radiologists more precisely giving the interpretation. Benefit of AI in medicine, like I said, it's for informed patient care using AI, and clinician workflow can give provider valuable context while they are making a decision. Some of benefits also is to error reduction. I think this is very important for us to have this error reduction to patient safety in our patient-centered care. The other is to reducing the cost of care. There are a lot of potential ways of AI could reduce costs across the healthcare industry. Some of the most promising opportunities including reducing medical error and fraud prevention and supporting more efficient administrative and clinical workflow. The others is to increasing doctor and patient engagement. As we know, during the COVID pandemic, we use telemedicine to help doctor and patient engagement whenever the doctor cannot see the patient physically. The other is to providing contextual relevance. One major advantage to deep learning is that AI algorithms can use context to distinguish between different types of information. I think this all the benefit for AI in medicine, and especially for microbiology. Next slide, please. We use this for chromogenic detection to get a faster screening for some important pathogen, and colony counting with growth or phenotyping colony recognition and application of expert roles in our interpretation. Let's say this is my last slide. In my opinion, Indonesia has a big gap on facilities because of its geography. As we know, Indonesia contains of many islands with different culture and still have obstacles to get health data record to be used as big data for AI technology. So we need a support system to solve this problem. I wish with this presentation and collaboration with others, especially with Taiwan, Far Eastern Memorial Hospital, we wish Indonesia as developing countries could use AI as a benefit and to collaboration to elaborate this dreaming, what we need in the future medicine using AI to become true. I'm very glad that UKRIDA has one of our lecturer, Ms. Enda Christiani, PhD, now is having a postdoctoral fellow of Tung Hai University, doing many research on AI. I hope, I wish if Ms. Enda come back to Indonesia, she will improve our AI technologies. Thank you, Mr. Wang.
Thank you, Dr. Wani. Thank you for your excellent talk. And now I will introduce Professor Sheung again and invite him to moderate the next session, including some of the company representatives from New Taipei City.
Yeah, okay, thank you, everybody. And
Thank
after lecture from our distinguished guest from Indonesia, I will introduce our later on I will introduce our 4 guests from our AI Alien in New Taipei City. And the first, I will introduce the COMDEK company. The representative will introduce their AI and the smart design in their company. Please.
Hi, everyone. Let me share my screen. 1 second.
Okay.
Oh, everyone can see my screen?
Yes.
Okay, cool. Well, thanks for the introduction. I guess we are a little bit behind, so I will make it quick. Good afternoon. My name is Chih-Hung, and I'm from COMDEK. I'd like to take this opportunity to introduce COMDEK's portfolio. So historically, we are a medical device manufacturer. We have been developing medical devices for decades, and our main focus is non-invasive measurement technologies for biomedical signals. Ranges from infrared thermometer, oxygen saturation, CO2 concentration, non-invasive blood pressure, EKG, and etc. And today we offer a wide range of products that are designed mainly for medical professionals. Our device portfolio includes handheld oximeters, mainstream or side-stream capnography, and patient monitors with multiple parameters. Like the majority of the medical devices, some of these are standalone devices, meaning the device simply measures biological signals, display the reading, and store the value locally. Although the reading could be exported via a wire interface, getting insight from the data is still a challenging process. However, with the evolution of IoT technologies, telemedicine has finally become a viable option. Today, only few selected medical devices could upload data to a cloud system directly. With telemedicine, doctors can monitor and diagnose patients virtually everywhere. Also, caregivers or family members can check the health status of their loved one on any personal devices. Well, similarly, hospitals are no longer the only places to receive diagnostics. Patients could receive diagnostics from emergency vehicles, hospitals, long-term care center, or even at home. Well, this cloud-based infrastructure allows doctors to provide immediate assessment or recommendations to EMS personnel and to track the health status of people in long-term care facilities. Another emerging application we are all too familiar with is to providing care to COVID patients while they are quarantined at home. So with this kind of architecture, there are plenty of possibilities. Imagination is the limit. So we have been actively developing our cloud platform, which integrates with our patient monitors. Our cloud platform offers many features, for example, device management, historical data analysis, real-time monitoring, etc. With our system, measurement data is safely stored in the cloud. Patients no longer need pens and paper to keep track of their measurement results. In contrast, they just need to select a time window and the basic stats and other useful information can be shown interactively. In addition, our platform features real-time visualization. Not only values can be shown in real time, waveforms are also streamed seamlessly to the cloud. Doctors can monitor the real-time waveform while a patient is still in an emergency vehicle, or nurses can easily monitor multiple patients in a nurse station to further reduce manpower. The real-time monitoring system generates visual alerts when the reading is outside of predetermined ranges, so people can easily identify and locate which patients needs immediate care. Our system also supports data integration. We can provide APIs for hospitals to query the data, so hospitals can keep a copy in their local database with formats they like. We also plan to integrate machine learning algorithms to help doctors to diagnose in early stage. So stay tuned. Well, that's it. Thank you.
Okay. Thanks, Mr. Guo from COMDEK company. Congratulate that you have a cloud platform, and also we think that is very important for telemedicine, especially in pandemic era. And this platform is very important for our immediate communicate our data and share our data. Thank you so much. And then I will invite next speaker from the EPED company, please.
Yes, good afternoon, ladies and gentlemen. This is EPED. I'm Patrick. Here I would like to introduce to very powerful surgical assistant, like we have a robotic and guidance device. So I will share my screen with all of you, and I can explain this step by step. Can everybody see my screen?
No.
No? Okay.
Yeah.
Share again.
Okay, take it easy.
Okay. 整个画面，你要先这个对啊，那就整个画面分享。How about now?
Maybe yes, no problem.
No problem now. Okay, thank you. All right, my company called we have name is EPED. We are currently quite kind of famous in global market. And if we join every Medical Europe or Alpha Health and German Medica, every exhibition, you can see our company and see our brand name all around the world. And currently, I would like to propose 2 medical devices that is benefit to Indonesia market. First of all, I would like to introduce our technology. We have 4 very powerful technology. The first one is medical imaging software that further I will explain how our software can use to help the doctor in performing every surgery. And second, we have optical space location technology, which in the world, there are maybe only 3 to 4 countries that have this kind of technology, and EPED is one of this company. And we have also surgical robotic arm technology, and that would be my second surgical device that I would like to propose to Indonesia market. And the most important thing is we can customize, do all the customization that all doctor or hospital they need. First of all, this is our surgical navigation system. We call it the retina. You can see the retina. You can see it's very helpful for help a doctor on different kind of surgery. You can see from the left side we have we can help on the neurosurgery, craniofacial surgery, ENT surgery, plastic surgery, also oral surgery, and other different kind of surgery. Focus on the brain, focus on the head, and we can help minimally invasive surgery and precise. We have precise optical space location technology, and we have high compatibility and high price performance value. You can see there are we have some main features, and these features they are quite appreciated from our client, from the doctor who are using our retina to do all the surgeries. First of all, we have path planning. We can plan all the paths before doctor they do the surgery, and we can help doctor to do the nerve indication. They can use and highlight before they do the surgery, and they can avoid some damage if within the surgery the path might hurt the patient. Also, we have a segmentation. They can help our doctor to highlight where is the tumor is and where is the main target they need to be approached within the surgery. Also, we have mirror function. The mirror function can help doctor use a complete side to restructure a damaged side. So there's our mirror function. And currently, we have different kind of cases, and in around global within these few years, we have more than 400 cases around the world. Here we can see is a case. This case should be from Greece, and we use on neurosurgery. And this case is we also use from the neurosurgery, and you can see in different kind of surgery room, it can be easily be placed on a right place for the doctor to see. It can be a doctor's another eyes and help the doctor to see through the patient's brain. Also, in plastic surgery, we can help doctor use the mirror function to restructure all the patients become complete. Also, in ENT surgery, we have very special instrument that can help in ENT surgery use very smoothly and very quick. And meanwhile, we also have cranial facial surgery and oral surgery. Different kind of surgery. Retina can focus on the brain, on the plastic surgery, on nerve surgery, oral surgery, and craniofacial surgery. Different kind of surgery that can help our doctor shorten the surgery time and also help our doctors, they can lower the risk from the surgery. Here we can see the retina worldwide. There are many medical teams in the global wise. They are using retina, like in Malaysia, in Greece, in Turkey, and there still are many countries now we are approaching. So I think in the future in Indonesia, that we can help Indonesia a lot, because Indonesia has more than 17,000 islands, and in the emergency room, a lot of hospital they are using in the emergency room, and they can use our retina to guide their doctors and help them to set up a very clear path. Okay, and here is the our second medical devices. This one we call it robotic arm and navigation system. It's especially on brain and nerve surgery. Here what is the product? The product is just like a robotic arm and a car, and we using this, we call it ePro. ePro is our robotic arm's name, and it can shorten the time of surgeries by almost more than 4 hours compared to other traditional frame-based procedures. Also, the robotic surgical system also helps surgeons reduce man-made errors, because sometimes if doctor's hand is shaking, it will damage the patient's brain. So we can help doctor reduce man-made errors. So our ePro is a robotic solution that assists surgeons in planning before the surgery and performing minimally invasive procedures. Also, we gained the Taiwan FDA certification in June of 2021. That would be last year. So with this year, we are trying to enhance all our functions, also collect more and more successful cases. For ePro, we have a very advanced planning software. We can use this software. We can do the pre-operative planning that our doctor can use this planning to avoid some very risky part. Also, we have guidelines more. We can use this guidelines more. The robotic, it can move by the path that was planning by the doctor in advance. Also, our ePro has a pre-running function. Use this pre-running function, we can check all the function and all the path is on the right track. Meanwhile, we still have multi-guidance function. The function can quickly switch multiple paths within the guidance mode. And for the time being, we have we are very confident for the below surgery that we have. We are quite confident we can do these surgeries like ICH, EVD, and biopsy in brain, also SEEG and DBS. This this is we would have already started to collect many successful case studies within the shortly future. Meanwhile, in our robot ePro machine, ePro device, we use AI recognize all the bleeding, and it can easily be calculated by our software and system to find where is the bleeding part in the brain. So it can help doctors shorten the the patient shorten the risk of time. And here we have lots of case study within this few months. But currently, we have already success for more than 30 cases in Taiwan. So currently, even whether ICH or EVD, we have already proved our success in the ePro device. So in the future, I think our ePro can help Indonesia market to help Indonesia patient and doctors performance and also the health of Indonesia people. Okay, that's my presentation. Thank you for your listening. Thank you all.
Okay, thank you. Thank you. And congratulations of the EPED company that you have matured different device. And especially I'm very impressed by your accuracy and the AI make maybe more confidence and convenient use for the surgeon in different field, especially your navigation system in different surgical field. And then I will introduce the third company from SEDA company, please. SEDA company, please.
Wait a minute. Hello?
Yeah,
everyone can hear me?
Yes.
Yes, okay. I'm Wilson from SEDA Chemical Product Company, and good afternoon, everyone. And today I'm going to share is that foam product development for pressure injury prevention and advanced care assistance. And first, I want to introduce my company. SEDA started in 1971, and we are a foam maker from OEM to OPM. We run the brand to sell the product directly to the customer. And we only focus on one thing. We design, develop, and manufacture high-quality foam product for increasing sleep health, comfort, and life quality. And also, we develop the medical product to help caregiver to decrease the daily care pressure. So this is our own value, to provide. And this is our new factory. And actually, we have our own brand. We sell a lot of product. I think everyone can use that. We sell the home for home user and also the care applications. And before we go to the topic, I want to share our own perspective about care. This is my daughter. Well, I have two daughters. And this is a dog. He is doing the X-ray examination. So you can see he is lying down very well and it's very stable because he feels comfortable. And this is the patient in the hospital. And here we want to share is that we believe that if the people can sleep well, the caregiver can feel the pressure, can decrease the pressure and also enhance the care quality. Okay, let's go back to the hospital scenario. I think everyone knows it is very important to prevent the pressure injury because of the elder people who suffer the pressure injury, caregiver has to pay a lot of time and money for the recovery. So actually, so mattress is very important. It's a very important item for pressure injury prevention. A normal foam density is around 30 to 50 kilo per cube meter, and this capability of pressure relief is not good, and also lifetime is shorter. So I think everyone will see this situation very, very frequently, right? there is a cap in the mattress because this is the low density. A lot of good foam is around 60 to 80, and these performance are better. So here this figure I shows a Chih-Hung mattress because Chih-Hung is a very good brand in the international market. Okay, here I propose our special material that is we call temperature sensitive memory foam, and this sensitive memory foam is our key material. And because the foam can sense our body temperature to change its functness, so it can provide a better body envelope and body immersion. And you can see this figure. Imagine that this egg is our body, and this blue part is the mattress. So if the contact area can increase, the contact pressure will decrease. So this is what we are doing to prevent the pressure injury. And also, our density is quite high in the market. So our density is over 90 kilogram per cube meter. So our material can not only get the handprint, but also get the fingerprint. So this is what we are proposed. And actually, before we sell the mattress to hospital, we did a pressure distribution experiment to see the difference between our mattress and the hospital mattress. And we get a quite good data result. And actually, we all know that our blood pressure average within capillary is 32 millimeter of mercury. So if we can keep the external pressure less than 32, then it is good for prevent the pressure injury. So actually, we also cooperate with Far Eastern Memorial Hospital to do a clinical study to prove the mattress is good for pressure injury. And we also published the journal paper in 2020. And here I used two videos to show the memory foam, the special point. You can see the video. I put two balls, and the right side, there is no rebound. And the left side, they rebound very high, right? And this is another video. Sorry. So the left side is the high resilience. The right side is our memory foam. The memory foam is with slow recovery. So it is good for pressure relief. And our material also passed a lot of safety and usability certification. Here I want to mention the flame retardant is very important, and I show the video. We can see the difference between the good foam and the normal foam. So you can see that when the fire on these two materials, our material, it burns very slow and the smoke is less. And when the fire is out, and then the material fire is out, so you can see the difference. So we use this material to develop our medical care product and widely used in Taiwan hospitals, including the mattress, wheelchair cushion, and the skin protector and pillow and so on, and widely used in Taiwan hospital. Okay, let's go to the main point is that we use this very good material to develop smart mattress. Okay, and actually we develop the sensing unit and also put into the middle of the mattress. And we can see there are 30 sensing units in whole mattress. We can get the body movement and the posture and also the sensing point. And by collecting this data, we can do more smart applications further. And the smart application like this, we can do the real-time bed monitoring, and we can get abnormal event alert, including bed leaving and or turning the body over alert. Also, we can get long-term historical data of the elderly people. And also we can check the sleep quality report of the elderly people. And we can check the personal life model. And because this system is IoT system structure, so it can integrate the other IoT devices for other applications. So caregiver can just use mobile device, computer in the nursing center. They can browse the data. They can see the real-time data and get abnormal notifications. And here I want to show you a real screenshot at a dementia nursing home scenario. So you can see the caregiver, they don't need to visit the home, that run visit one by one. They just use a computer. He can know the elderly people, who is on the bed, who is not on the bed, and the best situation. And you can see the different time you can get the different information. This is 4 p.m., 5 p.m., a lot of people on the mattress, and they go back after dinner. And you can see this side shows the notification, which people are leaving the bed. And most people will go back home, go back bed around 8. And in the midnight, you can close to the midnight, a lot of patients, residents will go back mattress. And the caregiver can just use the care system to understand the residents' best situation. And also you can see the red color, blue color means the pressure time. And also you can see which resident is moving their body or they sleep well. Okay, this is the real-time monitoring, the function. Okay, you can see everyone got up around 5 a.m. Get very early. Okay. So we can get a lot of detailed information without visiting the room. We can get 5 indices, including the in-bed time, in-bed pattern, sleep time, sleep efficiency, and prolonged pressure. And by collect this data together, and we use the machine learning algorithm and system, we can get an overall assessment dashboard on a dashboard. And the caregiver can understand the resident situation, who is great, who is normal, who is he need to take attention, or who is abnormal. So we can get the information in a short time. And the caregiver can provide the accurate care services. And actually, they can check every resident's single day's record and 1 day trend. And these data are driven by every day's the historical data. And actually, we get a lot of good response from caregiver. They told me it helped a lot because the daily in-bed data speak for older adults who cannot evaluate themselves clearly. And the sleep data is used to confirm the medication adjustment. And also pressure time and movement data is used to confirm whether bedridden residents are properly taken care of. And long-term living pattern data help to communicate with family member. And we believe that we can install this to the home, normal home environment for help the home caregiver. So actually, our system already can be installed for the scenario. So the caregiver could just use a mobile device to get the real-time data, including whether I can know whether my mom is on the bed or not, whether my mom have a lot of body movement, and how many times she sleep or not, what time he go to bed or leave the bed, something like this. And also you can get a lot of care notification from the mobile device. And because this is a IoT system structure, so we can integrate another Bluetooth devices, including the indoor notification application, and also vital sign collection, and also environment data collection. and a lot of data could be stored and displayed on your mobile device. And we can get the notification whether my mom is okay or not. So we can, and also they can share the information to other family members. We think we can create care interaction, connection, not only health monitoring. So what we are doing is we did a lot of value adding on the phone product. We hope we can create more and more better good care quality and decrease the care pressure. This is my presentation. Thank you for your listening.
Okay, thank you, Mr. Liu from SEDA company. Because my hospital has tested your high quality temperature sensitive metrics. It's a really good product, medical product, and I think that it can reduce a lot of pressure salt, prevent pressure salt for the long-term care of our patients. Thank you so much.
Thank you, sir. Thank you.
Okay, thank you. And our last topic is from the Wellell company. Please.
First of all, I want to make sure if everybody can hear my voice.
Yeah, Mr. Go.
Yes, my name is Gustavo. It's my pleasure to have this chat. I wonder if you can see my screen at this moment.
Yes.
First of all, Dr. Chang, Professor Sheung, Dr. Kuei, Dr. Tedy, Dr. Wani, thank you so much for giving us this opportunity, as well as my Taiwanese business friend. My name is Gustavo. I'm from Wellell company. We are specialized in design for mattresses, pressure area care that can prevent pressure injury. And today I would like to share with you about our new latest model, the Optima Prone, which is to be used for patients in a long-term prone position and how to help these patients to prevent pressure injuries. So as we can know that due to COVID, the severe respiratory distress has been affected more and more so, like the acute respiratory distress syndrome has caused many of the complications, especially impact the healthcare capacity and shortage. Therefore, we identify from many of the clinical papers that to keep the patients in a prone position, especially the ARDS patients, in a prone position, face down position, can bring a lot of clinical benefits, including improved oxygenation, improved secretion drainage, and also basically just to prevent patients from intubation with a mild respiratory syndrome under a high flow nasal cannula or non-invasive therapy to prevent from intubation. So patient in a prone position, it's highly recommended. But however, we see that in order to make the patient in a prone position, especially for patient under intubation, that is a very labor intensive and complex, because you will need at least a team of 5 caregivers to help to change the patient from supine to prone position. And then afterwards, once the patient is in a face down position, you need to have at least a team of 3 caregivers to help to lift the shoulder up, and then the caregivers, especially a respiratory therapist, in the middle to help to change the face position right and left, like every 2 hours, and to make sure all the tubing is well intact. So that requires a lot of work and a lot of resource, a lot of manpower. So understanding this kind of a difficulty or inconveniency, we developed this prone mattresses, not particularly for the COVID patient, and particularly for a patient with ARDS patient, we need to lie face down for a long time. So what we did is that we make sure that it has automatic workflow, which means that just using one caregiver can help to lift the shoulder up. And then at the same time, each individual air cells is divided into different zones and can be manually release the air, tailored pressure release. So it can help to create a space for patients to turn the head. So now you only need one caregiver to take care of prone position patients. Therefore, I just want to share a very quick video to see how this can be done. For example, right now I'm releasing the air cells, the air in the top area where the head is placed. So this section is release the air, and at the same time, we set the shoulder lifting. So this will create a space in this area. So when the patient is lying for 2 hours, then we can help to turn left just single-handedly by one respiratory therapist. And when the face is turned on the other end, have to obviously make sure that the tubing has been placed well set. And when that is confirmed, then we can help to reactivate the air cells that's in the head position, so the patient can be supported, the mattress can be support the patient's head. So that is basically the design concept that we do. Basically is to help the caregivers to reduce their time and also make it very easy to take care of this kind of prone position. Therefore, we collaborate with Dr. Pablo in University of Valencia in Spain, and we published this report in a European Pressure Ulcer Advisory Panel, EPUAP, where we compared a group of 4 trained specialists to take care of a prone position, a patient under prone position, comparing to only 2 trained clinical staff using Optima Prone with our mattress. And we can see the satisfaction score of using prone is very, very high comparing to others that is using a traditional way to take care of prone patients. And therefore, also in Thailand, we collaborate with Wellell Hospital, where COVID patients that has very, very low PF ratio, that's less than 200. For example, this patient is 80 mmHg, is a very severe ARDS patient. So we use this mattress for 4 days under prone position, and no pressure injury has been identified. And also in Thailand, in the Central Chest Institute, we see very similar results. As well in China, in the larger 3A hospital, Hunan Hospital, we also seen very similar and very positive feedback, as well as in Nanchang in China, as well as Hunan Henyang Medical Center. We also have been doing a lot of product training to help these caregivers to improve their service to the patient, as well as to improve the quality of life. We synchronize the brand purpose that we must respect every individual and to make a contribution to a healthy and carefree life. And we look forward to become a trustworthy, innovation-driven leading brand in a medical device. And that concludes my brief presentation. Thank you very much, Tedy.
Okay, thank you, Gustavo from Wellell Company, and I'm very impressed by your prone, so-called prone precision matrix. And it's a very spatial for our respiratory district patient. Optimal prone matrix is very good. Very good. Yeah.
Appreciate it. Thank you.
Because thank you so much. And I think that we are over time for this meeting, and we are very happy that we have our medical device from different company, and also AI specialists from our hospital and our friend in Indonesia. And I think that we should maybe very soon my hospital and our friends from the different company will visit Indonesia. And in the future, we will make a good connection and cooperation for improvement of quality of our patient care, and very fast, very accuracy in the medical procedure. Okay, please open camera, and maybe we should say goodbye each other.
so much.
Good luck always.
Okay, bye bye.
Yes, bye bye.
Great.
Thank you. 谢谢你。